All right. All right, guys. So yeah, today what we're gonna be talking about is back pain. This is super common. Probably, I would say probably the number one injury or pain point that we treat at Pro+Kinetix Physical Therapy and Performance. So before we dive into that, you guys probably some of you guys may know me from the last workshop. Some of you guys might not. So I'll kind of introduce myself. So my name is Dr. Ben. I'm the owner of Pro+Kinetix Physical Therapy and Performance. We have 3 locations, one in Oakland, California, one in San Diego, California, and then also one in Des Moines, Iowa. And you guys might be wondering, like, why the hell didn't, how'd you do Des Moines, Iowa, and then California? Like, that's super random, right? And so I'm actually from Iowa. So I recently moved back here to Iowa to open another practice. So that's kind of the reason for the vast differences in locations. So anyways, we specialize in helping active adults get back to workouts and sports they enjoy without having to do injections, without medications or surgery, right? Having to take time off. That's a big thing that we really separate ourselves from is most physical therapists that you see or physicians, they will tell you, oh, if you're having pain with, working out, or if you're having pain with like squats, or you're having pain with running, you should just stop. Right. And I think that's a poor answer. And most of our patients seek us out because we find ways to allow them to continue to do those things, not eventually, but right from the get-go. We just make modifications, and we have a vast background in sports. And so we are able to find ways that other physical therapists aren't able to find to allow you to continue to work out and be active while you're overcoming an injury. Okay, so we are doctors of physical therapy. We have our doctorates. Also, we're certified strength and conditioning specialists. So you guys might not know what that exactly is. So it's really essentially the gold standard of what personal trainers and strength and conditioning coaches can get. It's the highest level certification there. And actually, a lot of pro sports teams won't let any of their players work with anyone if they don't have their CSCS, or the certified strength and conditioning specialist. We're also USA weightlifting coaches. So we help a lot of people that are trying to get back into powerlifting, CrossFit, be able to get back to doing those things at a high, not just back to where they were, but improve their performance as well. So we really bridge the gap between rehab and performance. So enough about us, but in case you guys were wondering, like, who the hell's Ben? That's me. And then also Dr. John will be joining here shortly. Okay. So what are some objectives for today? I hope you guys identify the most common causes of back pain, an effective treatment for back pain, strategies for prevention if you're not having any injury, and then also, most importantly, guys, answer any questions that you guys have. Okay. We're really big proponents on education. A lot of times if you see a physical therapist, they tell you, oh, do these exercises, it'll make you feel better. Yes, exercise will help, but what's even more powerful in my mind is giving education is empowerment, right? Our big thing is we want all of our patients to be independent. We don't want them relying on us, another physical therapist, chiropractic care, massage, acupuncture, stuff like that. We want to give you as much independence as possible. So we go over tons of education, not just explaining like why the exercises are helpful, but why you're having the pain in the first place. All right. So we're going to be diving a lot into what the reason that you guys are having back pain, because once it's fixed, then it'll help you decrease. The more that you understand your injury, the better chance that you have of not re-aggravating it, or if not allowing it to come back. And then on top of that, if you understand the treatment and how it's going to help, you're probably more likely to do those exercises and treatment, right? So that's huge, and one big thing that separates us from other physical therapists and physical therapy clinics as well. Okay, so those are objectives for today. So low back pain is the single leading cause of disability worldwide. Years lived with disability caused by low back pain has increased 54% in the last 15 years. Why is that? Because we've changed our lifestyle to sitting so much more, especially in the last year and a half with the pandemic. A lot of people started working from home, not having the most ideal ergonomic setups. And so back pain has increased substantially just due to the nature of our work. We're not as active as a population anymore. So that plays a big factor into things, okay? Also, if you're experiencing back pain, you're not alone, all right? Actually, if you're not experiencing back pain, you are the minority, because 80% of the population will experience back pain at some time in their lives, okay? Think about that, that's crazy. So it's very, very common. and you're not alone if you are experiencing back pain. Okay, back pain results in $50 billion in healthcare costs each year. Okay, from time off and surgeries, injections, doctor visits, PT, chiropractic care. That's pretty substantial. All right, so big thing is prevention. Okay, so I don't want to bore you guys with the anatomy. Okay, but like I said, the better that you understand the anatomy, the better you're going to understand why you're having pain, and it's going to make more sense to you. And hopefully it will also kind of calm and make you more at ease with your injury, because a lot of times with back pain, it can be scary, right? A lot of people are scared and think it's super serious and all that too. And majority of the times back pain is not actually super serious. It's not going to be, you won't need surgery. You won't need, these invasive things if you take care of it right. And these are, I hope by going over the anatomy, it kind of just calms your guys' concerns. All right. So I want to walk you guys through this a little bit. So we have our spinal cord. All right. And that travels down a canal. All right. That is within our vertebrae. Our vertebrae are bone. All right. And we also have a disc. Okay. This disc is kind of like a jelly-like substance. All right. Much more soft than bone, obviously. All right. And then we also have spinal nerves. All right. That pass out through these canals on the side of the vertebrae. Okay. And so if you guys are having any pain down into your legs or spreading anywhere else, that most likely is due to a spinal nerve being compressed. Okay. And again, nerve pain feels scary. All right. It can be like burning sensation. It can be numbness, and it can be scary. And you can sometimes, if it's bad enough, you can feel it all the way down into your foot and into your toes. Okay. So that's a brief overview of the anatomy of the spine. Then we also have muscles. Okay, the multifidi, the quadratus lumborum, and the transverse abdominis. These are just fancy terms for your core. Okay, and they are responsible for holding the spine in place. All right, and a lot of times when you see a physical therapist, 9 times out of 10 they blame back pain on a weak core. Does a weak core play a factor into back pain? A lot of times, yes, but in my opinion, it's over. A lot of times when physical therapists don't know exactly what's going on, they just use core weakness as a default. Okay, because they don't know what else is going on specifically. So they say core weakness. In my opinion, yes, core weakness does play a factor, but a lot of times it's something else going on. A lot of times it's due to actually the positioning of like somebody's workstation, the way that they're working out, the way that they're moving. Is actually more important than actually core weakness being blamed for this. Okay, so hopefully that makes sense, guys. And again, if something doesn't make sense, please don't be afraid to interrupt. This can be a super laid back presentation. I'm really laid back in general. So if something doesn't make sense, feel free to interrupt and ask questions. Okay, we're also going to have time at the end for questions as well. But again, feel free to jump in too. Okay. So having this in the background now will help with the rest of the presentation. We'll be actually referring back to this quite a bit. Okay, so types of injuries. All right, herniated disc, sciatica, and then QL strain. So QL stands for quadratus lumborum. It's one of the muscles in the back that plays a role into the core. Most of the time that we're seeing is, I actually believe that herniated discs are actually underdiagnosed, and that, like I said earlier, core weakness is blamed when it's actually a herniated disc. So again, you guys might be thinking, "Oh crap, herniated disc, that sounds scary. That sounds like it needs surgery." No, in most cases it does not. All right. So what is a herniated disc? All right. You guys remember how we talked about we have the vertebrae that are the bone, and then we have the disc. Okay, it's full of fluid. Okay, and so if in certain circumstances this disc can get pushed back, all right, and herniate, and you guys can see how it's compressing on a nerve here, or the top view, this is the top view, it can be compressing on the nerve. This is a normal disc. So you guys can see that this nucleus, okay, is centralized. It's not pushing back or anything. You can see in this graphic, it is, okay? So what causes that? A lot of times it can be a traumatic issue, but most times it's not. Most of the time it's actually caused by sitting or lifting weights incorrectly, or sometimes car accidents, but that's kind of more rare. But usually it's due to our sitting posture or due to our workplace environment. And then also our movements when we're working out, such as like squats and deadlifts and lifting things incorrectly. Okay. So why does this happen exactly? All right. So I'm going to stop sharing my screen here for a second. I'm going to kind of use my hands to help explain this a little bit. So you have your low back here. All right. And then I'm going to do a side view so you guys can see. And I want you guys to do the same thing. You guys look at, if you guys sit up right, you guys can see, actually I picked a bad day to wear a black shirt and sit on a black couch, huh? But so you should have a natural curvature at your low back. Okay, it shouldn't be like rounding out. Okay, so if you have the right positioning and posture, you should have that curvature in that low back. Okay, and you guys saw that in the graphic as well. You saw that spine had a natural curvature. Okay, so if you are sitting with good posture, okay, sitting upright and have that natural curvature, that vertebrae, okay, those bones are stacked on top of each other, okay, in a correct manner. And so what that means is that compression of the vertebrae on top of the disc in between each vertebrae, it's equally dispersed around that disc, okay? So it keeps that nucleus intact and in the middle, all right? Versus if we bend over incorrectly and lift something up incorrectly, or we are sitting with poor posture and we're kind of slouched, now instead of having that natural curvature, now we're actually in that reverse position. We're like this. So now what happens is that front part of the vertebrae, that bone, is compressing on that front part of that disc. Remember, that disc is like jelly-like substance. That bone, that vertebrae is bone, solid bone. So guess what's going to win? That bone's going to win every time. So what it does is it pushes on that front part of that disc, and then it pushes it backwards, and that's how we can get some disc herniations. Okay, does that make sense, guys?
Yep.
Okay, awesome. So I'm gonna go back to sharing my screen here. So you guys can see in this graphic too, you can kind of see that there's a slight curvature of that low back, okay? So that's what I was talking about. But if we start rounding forward and pushing that back towards the back, now we get a lot of compression on this front part of the disc, and then we get the herniations, okay? So you guys are like, well, is that fixable? It is. In majority of cases, it is fixable, okay? We actually just got done working with somebody that their physician, their surgeon said that they were 99.9% certain that they were going to need surgery. And they had a pretty substantial disc bulge. And we were kind of actually on the fence that they were going to need it too. We weren't quite so certain. It was like a 50-50 shot. Anyways, this patient came in and they could barely even stand up straight. They were hunched over, walking in the clinic. And over a course of 3 or 4 sessions, their pain had decreased by 75%. After 10 sessions, they were back to playing sports. They were back to working out, strength training, running, and all that. So even if you guys do consult with, like, if you're dealing with back pain, you see a physician and the first thing that they want to do is tell you to do surgery or injections or medications without trying a conservative approach, I would definitely get a second opinion on things, okay? So that's our herniated disc, and that's probably the #1 injury that we see that causes low back pain. Okay, and I'll show you guys. You might like, well, how do we fix that? And we'll be going over some exercises to help you guys with that in just a second. Okay, I also want to talk about sciatica. I'm sure you guys have heard the term sciatica. Sciatica can be caused by a couple different reasons. It can be actually caused by a herniated disc. Sciatica usually presents as like low back pain, and then also some radiating pain down into like the back of the leg, into the glute or the butt region, and then down into the back of the calf. And if it's bad enough, it can be down into the foot and the ankle area, okay? Sciatica can be caused by, yes, this disc bulge pressing on the nerves, but also that nerve also passes down through the glutes, okay? So there's a muscle that we're gonna be talking about here that can contribute to sciatica. And that's why sciatica can be tricky to treat, because it can be coming from a couple different areas. Okay, so we're gonna talk about that in just a second, a little bit more. Then we also have the quadratus lumborum, right? Or strain. So the QL, these are muscles that are on the side of the spine. They're not, if you're having pain like on the side of your spine, kind of like about an inch or 2 off to the right or an inch or 2 off to the left, that's most likely not actually a disc bulge or sciatica. It's actually most likely a muscle issue. That's a quadratus lumborum is a muscle. And a lot of times this QL, it's not supposed to be providing a whole lot of support for the spine and the core. But if your core is weak and the other muscles aren't doing the job that's supposed to, this QL will get tight and get irritated and become strained. And so this is something that we see quite a bit as well. And also I want to let you guys know that there's not always just one thing playing a factor into things. We've seen people that have a herniated disc, sciatica, and a QL strain all in one. All right, sounds scary, it's fixable and whatnot, but sometimes there's more than just one thing playing a factor into things, okay? So that goes into, I wanted to talk about more about where the sciatica can be caused by. So the previous graphic showed your spine here, and then that nerve passes out here and it passes down. So this yellow thing is a nerve, okay? This is your sciatic nerve. There's this muscle called the piriformis. You guys can see it's a pretty small muscle compared to the gluteus maximus. So this is a big glute muscle, all right? And underneath of it, we have our smaller muscles here, okay? So you can see this piriformis is much smaller in size than this, or this gluteus max. However, if this gluteus maximus muscle isn't strong enough and not providing the support that it's supposed to, this piriformis muscle right here is gonna start taking up the slack and start becoming overworked. And when it becomes overworked, it becomes tight, okay? And so when it gets tight, it will compress down on that sciatic nerve, okay? And then that causes radiating pain down into the leg and sometimes down into the foot if it's bad enough, okay? So that's why sciatica can be tricky to treat. We gotta figure out, where is it coming from? The piriformis, or is it coming up the chain with the nerve passing out through the spine? Does that make sense, guys?
Yep.
Okay. What's up, Paul? Sorry, I didn't even see you were in here.
Hey, yeah, no, I was a bit late. Nice to see you again.
Yeah, you too. You too. Yeah, so those are really, there's a lot of other causes of back pain, but those are the primary three, okay? Majority of the patients, and most likely if you guys are dealing with back pain, most likely you guys fall in that realm of one of those three things, okay? So now you guys are probably wondering, like, okay, what do we do? What can we do about it, right? So the first thing is find and understand the cause of it, all right? A lot of these injuries present very similar, so it can be kind of hard to rule out. So you guys can try, I really strongly encourage you to try the exercise that we're gonna be going over today. And I'll also be sending over, the video exercises as well. So, and with the reps and sets and how to do them, they'll have a written description, video description, and video walkthrough. So you guys can take a look at those in just a second. We'll be going over them briefly. I'm not gonna have you guys walk through it because it might be hard based on your guys' setup currently, but I will walk you guys through these exercises a little bit and help you guys understand them. And so you guys, I definitely encourage you to try these exercises, but disclaimer, this isn't going to fix anybody and everybody. I wish it was that simple, all right? But if it doesn't seem to be helping or it actually makes it worse, definitely stop doing them if it's painful. But if it doesn't seem to be helping, definitely get it checked out by a professional, okay? Whether it's a physical therapist, a chiropractor, a physician, make sure you're getting this checked out by somebody, okay? So, because if you can't find and understand the cause, then it's kind of just like blindly throwing darts, the darts being exercises and hoping that one of them sticks, right? It's an efficient way to go about it. But once you find and understand the cause and figure out what's going on there, then we need to start restoring that range of motion and decrease the muscle tightness. And then also strengthening the core and the hips, okay? Also, if it is a disc issue, we need to start getting that disc back in place, okay? So let's see here.
Hey, Ben, sorry to
yes.
interrupt. I was just going to say there's a couple questions in the Zoom chat.
Yeah, all right, see those. Does that mean glute workouts are needed to make the muscle strong? A lot of times, yes. It doesn't have to be directly, good question. Doesn't directly have to be directly like specific for the glutes. Like for example, like doing deadlifts, squats, lunges, bridges, stuff like that in a safe way are going to help strengthen up those glutes, and those are usually the best exercises to do. However, deadlifts might, especially if your back is pretty flared up, you might want to avoid that or make sure that you're doing it correctly before you do. But big thing with like deadlift, squats, and lunges and bridges, those don't directly target the glutes. They're a full body exercise, but the glutes do play a big factor into it. And I'm big proponent on, I encourage big multi-body part movements because it helps that cores talk with the glutes talk to the hamstrings, the quads, all these different muscles interacting with one another versus just targeting the glutes, because you want all these muscles to be communicating, talking, speaking with one another to help provide the stability that is needed. But yes, glute workouts are needed to make those strong. Okay, but it doesn't directly just have to be an exercise that targeting 100% the glutes. Can be a multitude of things. Okay. Good question, Patch. And then are the workouts safe for people with scoliosis? Good question, though. So yes, it depends. The big thing is if it's painful, if any of these exercises that we go over today are painful, this isn't like a no pain, no gain type of thing. All right, PT with us does not stand for pain and torture. So if it's painful, stop doing these exercises. If it's not painful, it's fine for you to do. Okay, just make sure you're easing into them. But yes, they should be. Scoliosis does play a factor into low back pain. It's not as super common, one of the more common things that we see, but it does play a factor into things too, depending on the curvature and which way, and the degree of it and the extensiveness of it as well. So hopefully that makes sense. But yes, they should be, as long as you're not having pain with the reps and exercises, you can continue to do those. But if they are painful, definitely stop and let me know, and we can make modifications, or you can see also a professional in person as well. But good questions. Okay. All right. So let me go ahead and X out of this here. And then we're going to get into some of these exercises directly. Okay. Also, some other things that a lot of people don't think about is lifestyle modifications, right? Such as like weight loss. If you smoke, stop smoking, because that helps, that actually decreases blood flow and can decrease the speed in which the muscles repair themselves. Okay, and then also nutrition is a big piece to things as well. A lot of people are switching to vegan or a vegetarian diet. Nothing wrong with that. Just make sure that you're doing it in a safe way. So for example, there's a patient that I was working with recently, and she was really frustrated because she was trying these, she had worked with another physical therapist and was trying to exercise on her own and stuff like that. And she just wasn't making much progress. And so she came in and she told me like what exercise she was doing and like what the physical therapist was working with her on. And I agreed with the majority of what they were working on. However, something to add up was like, this is a pretty straightforward diagnosis. Why is this patient not progressing like they should? And so what we did is I actually looked at their nutrition and we talked about sleep. And what come to find out is they had recently switched to a vegan diet. And I asked them, hey, how did you go about switching to this vegan diet? Like, oh, well, I just cut out meat and I don't eat meat anymore. I'm like, okay, did you start supplementing with anything else? Or increase the consumption of protein in other ways, since you're not getting it from meat anymore? And she's like, no, I just cut out meat. So she was very substantially decreased. She was really lacking protein intake. And so because of the lack of protein intake, her muscles were not repairing themselves correctly. And so it decreased the body's ability to heal itself. So make sure you guys are looking at your nutrition, make sure that you're getting enough protein, okay? Especially if you recently switched to a vegan diet or vegetarian diet, or have decreased meat consumption there too, okay? Also, weight loss will help as well. It'll just decrease the amount of compression on the spine and the other joints as well. And some of you guys might, and this is where a lot of our patients are at, especially with the pandemic, is they state like, yeah, I've gained a lot of weight because of the pandemic and working from home, and the gym's closing, and I just haven't been working out as much. And now that I'm trying to get back to working out, it's painful. And so it's hard for me to lose weight because my back and my knees hurt, right? So this is like the power of making sure you're working with a medical professional that can help you make modifications to allow you to work out so you can lose weight, and in turn, by losing weight, also decreasing the pain that you're having as well. So for example, one activity modification you can do, like especially with like, this is off topic from low back pain, but if you're having knee pain, doing aquatic therapy and decreasing the load through the joints, but being able to move in a safe and comfortable way as well. Okay, so those are general treatments, just general treatment principles. And then also some questions that we get a lot are heat versus ice. What is more beneficial? So usually if it's like a acute issue, ice is gonna be a little better. But if it's been more of a chronic issue, especially if it's like a muscular issue, heat is gonna be more, it's gonna help you feel better. But at the end of the day, try both, and whichever one feels better, stick with that one, okay? Also, if you guys are, a lot of our patients come in and they're like wearing back braces, or they've tried back braces and they're kind of trying to wean themselves off of it. Our back brace is helpful. They can be, but in reality, we have a built-in back brace, okay? It's called the core, all right? And the transverse abdominis is the main core muscle. It's like a corset. If you guys look at the muscle, I'm wondering if I might have a picture of it actually. But if you look at the muscle, it's really just wraps around the entirety of your abdomen. It's essentially a built-in back brace. So we don't need back braces, and really the evidence and the research doesn't say they help a whole lot, okay? We're finding it's more psychological on what it's helping as well, okay? And then big thing is, if these things, and I said this before, if none of these things, these things seem to be helping, definitely seek out a medical professional, whether it's a PT, chiro, massage therapist, or physician. Don't struggle through this when you guys don't need to, okay? It's a lot longer road to recovery trying to figure it out on your own, okay? So want to help you guys also do some assessments, and I'll be sending these over here too. But we want to test out, like, help you guys figure out where, remember the first thing of treatment is figuring out what is the cause of this, okay? So there's a test called the straight leg lowering core strength test. Or the straight leg lowering core strength test. So what this does is you essentially lay on your back, and again, you guys will get videos, and I encourage you guys to do this after the workshop and help you guys understand and see where the pain is coming from. So what you do is you lay on your back and you put your legs straight up in the air. And what you're going to do is you're going to push your low back into the floor. And what you're going to do from there is slowly lower your legs. And what most of you guys will find is that your low back, you have a hard time keeping that low back pushed against the floor. And what you're gonna find is that low back wants to creep up, and you wanna start rounding and arching your low back. If you guys wanna try this right now, you guys are more than welcome to. But you'll find that as you lower the legs, the core has to work harder. And if that core isn't strong enough to support that, the low back's gonna start arching. And some of you guys, especially if you have back pain, this may exhibit and cause back pain. The good thing about this is if it does cause low back pain, we're able to isolate that most likely this is actually a core issue. If you guys do this, if you let's say you have back pain and you do this and this doesn't cause you low back pain, most likely the core isn't actually a problem or an issue, okay? So again, you guys will lay on your back, push your low back into the floor, and then you're gonna put your legs straight up in the air, and then you're slowly lower them down to the floor, okay? And the big thing with this is making sure to keep that back pushed against the floor and not allowing that to arch. Okay, so that's going to give you an insight into how strong your core is. Okay, and then also this is more for like if we were doing like a squat workshop, or if somebody's having back pain with squats. I want to keep this more geared towards you guys with regards to like ergonomics and setup and your desk setup. So I'm not going to go over this. This isn't going to be as directly helpful and applicable to you guys. So we're going to pass this. This is another test that can be really helpful. Again, you guys just lay on your back. This is a Thomas test. So essentially you lay on your back and you bring one knee to your chest. And what we're looking at is actually looking at this leg. This leg should remain flat, okay? You can see that their knee is coming up. So what we're testing is we're actually testing the muscles of the hips and testing tightness surrounding the hips and the low back. So if this is a positive test, what I mean by it is if you bring your left knee to your chest and you see that your right knee arches up like this, that tells me there's a lot of hip tightness going on, okay? There's a muscle in the front of the hips. It's called the hip flexor. And so that attaches down kind of by the front of the thigh, and then attaches actually part at your low back and then part at your pelvis. And when we're sitting for a long period of time, or when we're sitting position, that muscle is in a short position, so it can get tight. So that can contribute to low back pain as well. Ideally, when you guys do this, your leg is straight. Okay, so this is going to give you insight into if it's actually your back pain is actually stemming from your hips and hip tightness. If it is, we need to start doing some hip stretching exercises on that front. Okay, those are the two main tests I want you guys to go over. That will start giving you some insight into what's going on Do those tests make sense, guys? I know it's not the easiest, but you guys will get videos on how to perform these afterwards as well.
Makes sense for me.
Awesome, cool. Patch is asking, is flexibility considered a factor when doing the Thomas test? Yes, absolutely. Especially when it comes to flexibility of the hips. If your hips are tight, that's again decrease your flexibility, and in turn increase the likelihood of you having a positive Thomas test. So yeah, absolutely, flexibility is a huge factor into impacting that. Good question. All right, so what we're going to do next is we're going to move on to some of these exercises. All right, guys. So what I'm actually going to do is I'm going to actually demonstrate some of these for you guys. Make sure you guys can see this. So the piriformis stretch, we talked about how that piriformis can actually cause some of the sciatica or some of the low back pain. So what you're going to actually do, and you guys don't have to demonstrate, you're more than welcome to go through these with me if you want. Otherwise, like I said, you guys will get these on video as well. Okay. So what you're gonna do is you're gonna lay on your back. Okay. And then what you're gonna do is you're gonna cross one leg over the other. And then what you're gonna do is you're gonna take your knee and you're going to bring that knee over to your right shoulder. And you're gonna feel a nice stretch deep in that glute area. Remember where that piriformis is located, guys? Right in this area, okay? And so you should feel a really good stretch on that, okay? You're gonna hold for 30 seconds, and you're gonna do that for 3 sets, okay? So do 30 seconds one leg, and then you're gonna switch, do the same thing. Remember, you're taking this right knee and going to the left shoulder. It's always opposite shoulder, okay, of the knee that you're pulling on, okay? Again, you should feel a nice stretch in the glute area, okay? By stretching out this piriformis muscle, it's going to decrease the compression or that piriformis pressing down on that sciatic nerve that travels underneath of it. Okay? It's going to decrease radiating pain down into your foot, and then also decrease low back pain in turn as well. Okay. Any questions on that exercise, guys? Hopefully it's pretty straightforward. Okay. Good. All right. And then the next one we have is the posterior pelvic tilt. Okay, this is actually one that I'm going to have you guys, I'm going to demonstrate in sitting for you guys because it's going to be more applicable to you guys with regards to I want you guys to be able to do these exercises easily without having to like get on the floor or anything. These are things that you can do just sitting at your desk. So what you're going to actually do, let me actually demonstrate this in an actual chair. So what you're going to do is you're going to sit with good posture, and what you're going to do is you're going to arch your low back as much as possible, and then you're going to round out as much as possible, and then arch and round out. Okay, so what this is doing, guys, remember we talked about, and this is what's going to help get that disc back into place. Okay, remember, if we round out, it's pushing that disc back. If we arch forward, it's going to start pushing on the back side of that disc and push it forward back into place. However, if the disc is herniated bad enough, sometimes this can actually do more harm than good. So if this is painful, definitely stop doing it. But this is really only in extreme situations. If you guys would know if it's going to make things worse, I'd be excruciating pain doing this motion. It should actually feel almost good. Okay. So again, what you're going to do is you're going to arch as much as possible. Arch, round out, arch, and round out. This also helps lubricate the spinal segments as well, not just at the low back, but also up at the mid back as well. Okay, so you're arching, hold for about 3 seconds, and then round out. Okay, so it's going to help with this. If I could pick one exercise for you guys to do consistently, it'd be this one. Okay, it's super simple, right? Okay, but you just need to do it consistently, ideally twice a day. 15 reps, okay, 3-second holds. Any questions on that, guys?
I have one in the Zoom chat.
Oh, yeah, let me see here. What if it's painful on the shoulder side? Is that for, sorry guys, was this for the one that we just went over? Is that for the piriformis stretch, the first one we did? The second one. Yeah. So what you can do is it shouldn't be too painful in the shoulder. If it most likely it is painful in the shoulder, it's probably due to tension. What you can do, try and do instead, is cross your arms across your chest like this. And then what I want you to do, and don't make so much movement at your neck area, just focus on going at your low back. Do you guys see how my shoulder's not moving so much now? It's mainly just coming from the low back. That's how you can kind of work around any shoulder pain that might be associated with that.
Thank
Yep. But yes, if you're having pain with that, it most likely means that there's some shoulder tension going on too. And I think that's probably the next workshop that we're going to do is associated with like neck and shoulder tightness, because that's probably second most common thing after low back pain. Okay. So next one I want to go over is actually the last one. This one's not going to be as applicable to you guys. This one's a little bit, this is going to be a little bit more too intense to start out right now. What I want to focus on is this lower trunk rotation one. Okay. So what you're going to do here is, again, you're going to be on the floor for this one. So you're going to lay on your back. Okay. And then what you're going to do is you're just going to drop the knees. You're going to keep your shoulders flat on the floor, and you're going to drop your knees to try and go to the floor. Starting out, I want you guys to just do small oscillations back and forth. And then what you're going to do as you get more and more comfortable, then you can start bringing the knees further and closer down to the floor. So ideally you're getting here and then down to here. Okay, back and forth. And make sure that you're not letting your shoulders roll over like this. Both shoulders should be in contact with the floor. Okay, you guys remember how we talked about that QL and that QL tightness? Okay, this is going to help with that exercise, or this decrease the tightness there. Okay, so those are 3 exercises that are going to be very safe and effective for you guys to do and get you guys started with decreasing this low back pain that you guys might be experiencing. Okay, so we went over the posterior pelvic tilts. Okay, that's going to help the disc. We also went over the piriformis stretch, which is going to help with sciatica. And then we also went over the lower trunk rotations, which is going to help with the QL tightness. So remember, the main 3 topics we talked about, those 3 exercises are hitting each of those 3. Okay, and you should be able to start getting some instant pain relief by just simply doing those 3 exercises consistently. Okay, guys?
Yep, helpful.
Awesome. Okay. And then also prevention. I'm just gonna go briefly over this. Really just listen to your body. If something is painful, like I got off the phone with a patient, her appointment's not for another 3 or 4 days, but she's like, yeah, I'm not really understanding why I'm having so much back pain. It seems like it was worse since I saw you. I'm like, well, walk me through like the last 3 or 4 days on what you've been doing. And she's like, well, I went on a 6-hour car ride, and I'm like, well, that probably, I mean, that will do it. So she's like, yeah. I'm like, did you have pain with that at all? And she's like, yeah, I started having back pain, in the first hour. So that tells me that sitting is definitely contributing to this, right? So make sure you're listening to your body. If you're having pain with a lot of sitting, make sure that you're utilizing a standing desk occasionally, walking around, just moving around more and not sitting so much. Okay, so listen to your body on what it's telling you. That's going to help a lot with prevention and making sure that this doesn't become a bigger issue than what it needs to be. All right. If you're doing workouts, making sure that you're doing warm-ups and cool downs and you're stretching after your workout. Okay. Nutrition, hydration, we talked about that. And engage in a variety of exercise. Like this is something that I need to work on. I just do a lot of strength training. I need to do more running. I need to do more swimming, biking, stuff like that. Make sure you don't get a rut of doing the same mode of exercise over and over again if you're exercising. And then also ergonomics, right? We talked about that last time. Let me know if you guys need the replay of that. I think I have it. I can send that to you guys. If you guys don't have a recording of your own, I can send that over. But making sure that your ergonomics are set up correctly and that you're in a good position throughout the day. Okay. This just really kind of just reiterates and hits home, making sure that if things aren't improving and you're kind of in this rut, make sure that you get like an assessment done. Make sure that you get a detailed assessment looking at the hips, your legs, your range of motion of the hips, the low back, and then also making sure that we're looking for any muscle imbalances that might be at the core, the hips, and the lower body as well. And like I said, make sure you, if it's not improving, then seek help. Okay, this isn't something, if I had $1 for every time I had a patient that told me, oh my gosh, why didn't I do this years ago, I'd be very, very wealthy. And so main thing is don't be having, you do not have to deal with this pain. There's had literally over hundreds of patients that have been dealing with pain for over a decade. And they're like, this is absolutely ridiculous on how much things I missed out on my life because I just accepted the pain when it was this easy of a solution. So make sure you don't fight through it, and don't just accept that you have to live with this, because 99% of the time it's not. There's always something that you can do to not just decrease it, but fix it entirely. So don't live with this if you don't have to. All right. There's always a solution. So like I said, guys, one of the most important objectives for today was to make sure that you guys didn't leave with any questions. So we had about 10 minutes here to allocate towards pure Q&A. It doesn't even have to be to back pain. You know, we treat pain for the knees, really the entire body. So it doesn't have to be just localized to back pain. So I want to put you guys in the box there. So the question came in. I have pain in my back in the same place that you've shown on the first slide, but I'm experiencing it when I cycle for more than 20 to 30 kilometers. Can it be because of the same reason that you mentioned? Yes, it can be from biking or cycling, because a lot of times with cyclists, they're hunched over on their bikes, right? And so what happens is now you are in that rounded position at that low back. Remember how we talked about if you go in that rounded position, it's going to press on that front part of the disc and push it back. So it can be definitely playing a factor into things. So just make sure that you try and keep that neutral spine so you're not so rounded out. Okay, you don't want to be look like the Hunchback of Notre Dame with things. So try and keep more of a neutral or straight spine instead of being rounded out. That is going to help a ton. And then also, if you sometimes with cycling in general, it's kind of hard to be in that position the entirety of your ride. So it is okay to go in that positioning, but make sure that you're taking some breaks and that you are doing those pelvic tilts like that we talked about, because you can do that on the bike as well. So make sure that you're doing the arching, because it's going to help push that disc back into normal positioning. So hopefully that helps, Alex. Does that make sense?
Yeah, makes sense. It helps when I take a pause and make this some kind of exercise that you mentioned, and I take a break for about 5 minutes. And I was thinking, can I do something to increase the distance, but I can the distance that I can ride without experiencing, this pain? How I can do it?
Yep, for sure. And that's the thing too, is also with desk positioning too. You can put a rolled up towel, or there's things you can buy. I think there's a product on Amazon that you can get. It's like a bolster, and you can put that behind your low back. So even because I hear it from people all the time, oh, I fixed my posture, and then 2 minutes later, I'm realizing I'm back in the exact same positioning. If you get this bolster, if you put it in your low back or behind your low back, and even if you forget about your posture, you literally can't go into a bad posture.
Oh, I see.
Right. So you can use a rolled towel. You can go on Amazon. I think they're like 20, 25 bucks. And that's one of the main things I recommend to my patients if I know that they're sitting quite a bit throughout the day because of work and don't have the best ergonomic setup. That's a really easy fix to help decrease some of the back pain with that. Okay.
Guys.
There you go. Yeah, Paul, did I tell you to get that?
Yeah.
Yeah, I was gonna say, yeah. So,
funnily enough, after I started using mine, LeBron James got the same one.
Yeah, conveniently, right?
Yeah.
Just coincidence.
It's especially good for traveling too, because my chair is pretty good here, but if I'm at the airport working or in a coffee shop or something, you can just slide that behind your chair, and it helps a ton.
Yeah, if you guys watch next time you guys watch an NBA game, Lakers game, most of the time LeBron has this on his chair as well. And
you guys
LeBron,
why does LeBron use the same pillow as Paul? And you'll see that.
Right. You'll get your answer exactly. But yeah, I mean, LeBron spends millions of dollars on his body, and he and he hires the best people, best trainers, nutritionists, stuff like that, to make sure that his body is in peak condition. That's why he's able to play at such a high level, because he's checking the boxes on all these different things. You guys will also see if you guys look at his chair, he will also be sitting much higher than the rest of the players. Yes, he is tall, but there's also centers that he will actually be sitting higher on, because what he does is, because normal chairs are too small for him, right? Because he's so tall. And so his legs are usually, like, if he didn't use what he uses, his legs would be up to his chest like this. If you like look at NBA players on the sideline, they are in terrible ergonomic positioning because the chairs are made for everyday people, not NBA players. So LeBron actually has like a box that it's a better term than a box, but essentially it is a box that's like elevated by like a foot. And so it makes it so his knees aren't close to his chest when he's sitting in a chair, right? So that's just like an ergonomic change that LeBron James made, right? But it just goes into things that just goes into the account that he's factoring in literally every little thing that could detriment his career and his performance, right? So definitely you guys, like Paul said, you don't have to just use it for your work. You can use it for, like, you're traveling like on an airplane. Like, airplane seats are the worst. Like, they pretty much make you hunch over, like how they're built. So if you use that, or just use like a rolled up towel or something like that, that can make a world of difference with traveling as well. Okay, so hopefully that makes sense, guys. What other question you guys got? And then, yeah, I think next workshop will probably do like shoulder or neck, if you guys feel like that would be most helpful for you guys. But if you guys have, again, don't want to just put words in your mouth, if you guys got a different topic that would be more helpful, I'm all ears on that. What are your guys' thoughts there? What would be most helpful to you guys?
Shoulder pain.
Perfect. We'll do
Sounds
shoulder.
like patches of shoulder pain.
Yeah, we'll do it. We'll probably tie in shoulder and neck, because they kind of coincide with things. So we'll kind of do a little bit of both with that. Okay. Also, I do want to introduce Dr. John. He's he's actually in Iowa with me. I think he's on here somewhere. John, do you want to pop on here and just introduce yourself? He's actually commuting. We have 2 different locations in Iowa, so he's actually maybe commuting right now. It's from one location to the next. So
yeah, hey guys, I'm in my truck right now, but yep, I was able to join for most of it. So looking forward to talking with you guys next time.
John, make sure you have good posture when you're sitting in the truck. You can get one of these.
Yeah, he needs one of those. So, but yeah, that's John. He's a manager for the Des Moines location that we have here, and kind of mans that. So, super awesome guy, and we'll be able to help you guys out a lot as well. He's actually a shoulder and neck specialist, so he's going to be definitely tag teaming a lot of the workshop, if not the majority of it. My specialty is kind of the low back, so he's gonna be able to help you guys out actually more than I can on the shoulder. So he might be popping in for next time as well. So any other final questions, guys?
All good for me.
Okay, awesome. Cool. I only have one favor to ask you guys. We, as you guys know, like, we're actually, our Des Moines location's our newest one of our newer locations. If I'm going to send Paul and Patch the link to our Google reviews. If you guys, or a Google page, if you guys could just like leave a review on this workshop, and if you guys found it helpful, leaving a review and your experience and what you learned and how it helped you and all that too, would be super powerful and super helpful to us, especially gaining more traction in this newer location. So if you guys do that, that would be awesome. I'll send over the link here after the workshop, and feel free to do that if you found it helpful. So but yeah, guys, Paul, thanks for having me, and Pat for helping set it up as well. So but yeah, if you guys have any other questions, I'll also give Paul's got my email. Paul, feel free to pass out my email address to everybody attending if they have more individual questions that they need answered. I'm happy to help. Or if you guys have questions over the exercises or have pain or difficulty with them, or just questions in general, just email away. Okay.
Cool. Thanks, Ben.
Yeah,
Thank
for
you.
sure. Absolutely, guys. Absolutely. Thanks for being awesome. And you guys asked really good questions and makes it a lot easier on my end when people are asking good questions, engaging too. So appreciate you guys' attendance and interaction there too. So we don't have a hard date on the next one, but I imagine it'll probably be the next month or two on that front. So talk to Patch and Paul and we'll see if we can get that rolled out. So hope you guys enjoy the rest of your Tuesday and rest of your week. And then I will be seeing you guys relatively soon.
Yeah, thanks, Ben. Looking
You
forward to the next one.
too.
Bye, guys.
Bye.
Yeah.